Most chemotherapeutic drugs can damage a female's eggs and men's sperms. In the female, it depends on the age, type of drug and the dose and duration used. Most of the chemotherapeutic agents can be classified according to the phase of the cycle cell in which they are active. The action site of each chemotherapeutic agent is different. Alkylating agents act on the DNA, antimetabolites on the DNA synthesis, and spindle poisons on the process of the mitosis. Therefore, the use of a specific agent will define the aspects of the ovarian function which are likely to be more sensitive regarding this substance. The drugs most commonly causing the damage: busulfan, carboplatin, carmustine, chlorambucil, cisplatin. The chemo which are of low risk of damaging the eggs are 5-fluorouracil, bleomycin, vinblastine and vincristine. So, it is advisable to talk to your treating doctor about the fertility damage with chemotherapy, an option for preservation. Statistically, if the age is less than 35 years at the time of chemotherapy, more the chances of getting pregnant after the treatment. The younger you are, the ovaries has got good or more quantity of eggs. This gives an higher chances of having fertility even after chemotherapy. Girls have chemotherapy before puberty or just at the time of puberty ends, up in early or premature menopause by the age of 35 to 40 years. This means that their eggs are exhausted and they end up with no menstrual cycles, resulting in menopause due to no production of hormones, that is estrogen and progesterone. This is called as premature ovarian failure or primary ovarian insufficiency. In such cases, planning of pregnancy should be at the earliest post-marriage. The chemo drugs are damaging to the fetus, causing birth defects. Hence, it is always advisable to use very effective birth control and not to plan your pregnancy at the time of chemo. Women are often advised not to get pregnant within the first 6 months after chemo. The chemo might have damaged the oocytes growing or maturing at the time of chemotherapy. If the affected egg is fertilized, embryo could miscarry or the baby may have genetic problems. The chemo agents damages the lining of the testicles, which produces the sperms. This may lead to decrease in the sperm count or oligospermia, or no sperms in the semen known as azoospermia. The damage may be reversible in some cases but takes a very long time or several years, but mostly it is permanent.